Hello, and thank you for joining us for today's episode of Pod Bites. I'm Verna Collins Odoom, and today we are talking about something that is impacting millions of families across our country, educating our children during a time when COVID 19 numbers are continuing to climb. Among the statistics, children. On the CDC website, you will find this quote. Most children and adolescents with the virus that causes COVID 19 have mild symptoms, and some have no symptoms at all, end quote. Now, we do know that children have died from COVID 19. The number, however, is the lowest of the age demographics, but still, one person of any age is too many. The site goes on further to say that because children with the virus that causes COVID 19 can spread it to other children and to adults, it is important to take measures to minimize risk of spread in school settings. Then there's this quote, resuming and maintaining in person learning may pose risks to children, teachers, school administrators, and other staff in the school environment and their families and household members, end quote. So today, we want to take a closer look at one particular school to learn how it is faring during this time. That's where we bring in our guest, Benita Knight. She is the vice principal at Martin Millennium Academy in Edgecombe County as a public school in North Carolina. Thank you so much for joining me, Benita.
Thank you for having me.
We appreciate your time. Well, as a school communicator, what do you think when you hear what seems to be a warning or a disclaimer, even from the CDC? Basically, there's a plan from the agency to operate schools during this pandemic, but to implement that plan is to do so at your own risk. How do you feel about that? I'm setting our 10-minute timer right now.
Um, I think it's it is the nature of the job that we have at this moment, and while I think there is an inherent undercurrent of fear for the majority of staff returning to our buildings, we are pressing forward and doing the job that we have all committed to do, which is that of educating our children with safeguards in place.
Let's talk a little bit about those safeguards. Give us the basics. What plans are in place, as a CDC site says, to just minimize the risk of the spread? What plans do you have in place there?
So right now, the way that we have our building set up, we have established one-way hallways where you can only walk one certain direction. We have children who are now no longer going to the cafeteria for lunch. Lunch is being brought to classrooms. We have utilized all green spaces within our campus so that we can separate children during their outdoor recess time. And within classrooms, it is not a requirement for our K-5 classes. It is a requirement for our 6-8 classrooms. So children are either 6 feet apart in 6-8 classrooms. In K-5 classrooms where they cannot be 6 feet apart, they have to have personal protective dividers between them. So
Meaning
those
what?
measures that are in place. It's basically like a plastic shield that covers the child on three sides.
Wow. Okay. So at your school, you've talked about the measures and the preparations and the daily, I guess, things that have to take place to protect students, teachers, administrators, and so on. Do you feel it's enough? Has it made the school safe enough?
Um, I don't I don't know that anyone feels completely safe,
Mhm.
but I think there is a sense that measures have been taken and we are safer.
Okay. You have had COVID cases as other schools have at your school. Is that correct?
That is correct.
Okay. Have there been a lot, or how many? Can you tell me how many?
Off the top of my head, I know one student and at least three staff members um, have actually had COVID. I can say since we have started back in person on November 5th, we have not ever gone a full week with full staff or with full students because there's always someone who is out quarantining. And that is definitely a challenge.
And I want to talk about that, the depletion of teachers, of staff as this COVID epidemic continues. But once you hear that a COVID case happens, what goes into place? What happens? A person is asked to leave school, a parent's called. What happens?
So that job really falls on the building principal, and it is time consuming because then contact tracing has to start, where we have to determine you know, who was this person in contact with, who may have been exposed, so that we can quarantine all of those individuals. For us, luckily, with the staff members, they hadn't been in the building prior to when they contacted COVID. With the scholar, I think there was only one other child who fit the criteria for exposure, so more than 15 minutes without a mask. Um, because children want to play together during recess. So unfortunately, there was another child who had to be quarantined as well.
And what does that look like, recess? What happens at recess? Because kids need
So
exercise during this time. They need to get
they
out.
do need exercise, and our scholars are also required to wear masks at all times. So we do not have a policy in place where there's a mask break. But of course, at recess, sometimes, kids will take off their mask, but they're outside, they're playing, they have their mask on. If they're within 6 feet of other scholars, it's normal recess,
Mhm.
laughing and having fun.
Okay, and just with mask and other protective gear.
If they're going to take off their masks, we have hula hoops set up so that they are in their own personal hula hoop, and then they can take their mask off.
Okay. So, talk a little bit about the delay that's happening. I know school was supposed to start at a certain date, but now it's been pushed back. Do you feel that that is going to make it more safe, or do you feel that maybe decision makers are kind of taking a cooling off period to see where the numbers go? Then they might make other decisions.
Um, we really don't know. Those are decisions that are made outside of me. That's the Board of Education in conjunction with our superintendent, I guess, looking at the data and the numbers from our Edgecombe County Health Department. But they did make the decision to delay the opening by 2 weeks. So we're now having virtual learning for 2 additional weeks as we get ready as we hope that the surge kind of dissipates before we bring scholars and teachers back into the building.
Okay, and now you're looking at a picture of the school where you work, and I know that you said that you are going to be back there pretty soon. Do you feel, because it sounds like there's so much logistical work that's going on, there's very creative work that's going on as far as distant learning, staggering or bringing in people at different points, staff and students at different points to kind of be safe in the building. But there are lots of logistics, schedules, planning. Do you feel that that gives enough time to actually do good teaching? Do you feel like teaching is being jeopardized or the focus because there's so much focus that has to be put on these health
Mhm.
risks?
Well, what I will say is that our teachers, our educators are amazing. And the work that they have done since really March has been phenomenal in shifting their practice.
Mhm.
Um, Unfortunately, yes, education is being jeopardized by the loss of instructional time. But I know it within our building, the time that they have is being utilized to the fullest every minute, including time that we have provided for teachers to provide that virtual instruction to their scholars who are continuing to be remote learners by the choice of their family. They are really utilizing that time to its fullest.
Okay. And teachers are really doing some double duty, triple duty, even as far as getting in, working with students that are on campus, as well as working with those who are at home. Is that right?
That is true.
Okay. And so if I were to look at how the teachers and administrators are feeling right now, if you were to put it into a word, overwhelmed, underappreciated, ignored, what do you think is the overwhelming or the overriding feeling?
I feel like all of those words apply. Um, Definitely overwhelmed. I think definitely underappreciated. Um, but also, I would say that they're feeling resilient and ready to take on the challenge that is, um, and hopeful that things will change in the near future.
And I know that we've heard a lot about frontline. We only have about 2 minutes. Frontline medical workers who have described a part of what they're feeling, overwhelmed, no relief in sight. Educators do everyday work of actually, in many opinions, in my opinion, of saving lives, but in a different way, not maybe an immediate or acute way, but by giving children options to explore potential, what they want to become, what they want to do to change their actual life circumstances. What would make a decision, or who would make a decision about mental or physical relief for teachers in school? What level is that? Is that the school board?
Um, Mental and physical relief for the
So as
teachers.
far as getting other people in, I can't imagine, and you and I talked about this before the interview. I can't imagine that there are a lot of people signing up to come and be a substitute teacher, let's say. So when somebody has to be out, who's coming in? When the
Right.
school needs to be closed, how is that handled?
Yeah, I think right now there are a lot of building level administrators. So my admin team and we are doing what we can to provide relief where we can,
Mhm.
um, in terms of providing classroom coverage and things of that nature when people do have to be out. Um, Unfortunately, we cannot create bodies. And in this age, like parents are not even allowed into the building. No one is allowed into the building. Even if your child is late for school, you have to call the office and we meet the child at the door to let them in. So, because we're trying to be as safe as possible, there's just not a lot that we can do to bring in outside people to provide extra help.
Okay, I have two questions. We only have about 30 seconds left. Let's see if we can get them in here. One of the questions would be, there's a school in Chicago scheduled to open January 11th. They're saying they're concerned that teachers aren't going to show up. When your
Mhm.
school opens on the 26th, if it does open on that date, do you feel that your teachers are going to show up? Your administrators are going to show up?
Yes, so our teachers have actually been working since January 5th. We came back January 5th. Our teachers have been in the building since January 5th. So, right now, physically, our students are not in the building, but teachers are still coming to the building every day to work.
Okay, you hear the alarm. So unfortunately, I can't get that
Mhm.
last question in. You did great. I appreciate your time. I do want to throw out a couple and sum up a couple of things, a few takeaways. We call them bites here, that we got from our conversation. You did talk about there's a constant feeling that the safety of your building, you can't make it as safe maybe as possible that you would want it to be. You do everything that you can. All the precautions have been put into place. All the recommendations are being used, and you're being very creative, but you can only feel as safe as you can feel during a very changing situation with a virus, obviously. Uh, Also, you talked a little bit about time loss. You talked about that teachers are doing great with being creative, as we just discussed, doing a plan. But there is instructional time that's being lost because of the complicated systems that are in place right now to get these kids schooled. But you did talk about the resilience of the teachers and the administrators, and you really are applauding them, which we are as well, for coming in and doing this great job every day. I appreciate your time, Benita. Thank you so much for talking to us today. All the best to you and your staff as you and your school continue to teach our children in creative ways during these unpredictable times. Thank you.
Thank you again for having me.
I appreciate it. And thank you, everybody, for listening. We, of course, will be back next Sunday with another Pod Bite. We appreciate your time and take care. Have a good week. Bye bye.